Hi everyone, Dr. Brown here. As you may or may not know, January and February are our dental months here at Foothills Animal Hospital. Now, what that means is that we have a greater emphasis on oral care and dental disease here with our patients. In veterinary medicine, especially in our small patients, we do have a lot of problems with oral health. So we see a lot of dental disease, and why we worry about this is because dental disease does play a role in overall health. So when we have a patient who has chronic inflammation, chronic bacteria, and chronic pain, it often will affect them overall, and we can see some changes in them. So right now we are offering some discounts on our dental procedures, and we always recommend and offer complimentary dental exams on all of our patients so that you can come and have a exam done by one of our lovely technicians, and they can look at the mouth and see if maybe some home care can be done or if maybe a procedure would be recommended. So the reason that we recommend dental procedures some of the time is because we'll see teeth that we think are big troublemakers that probably need to be removed from the mouth. And the reason that we do that is because they may have abscesses at the root that are a chronic cause of, again, inflammation, bacteria, and pain, and we need to remove that tooth in order to clear up that site. So today what we're doing is a dental procedure on a patient of mine, and I'm going to take you through the day so that you can see what we do from start to end. So you'll see us getting the patient ready for surgery, and then I'll go over radiographs with you as well as some of the procedures so that you can get a better understanding why it's important, why it's needed, and maybe why it's applicable to your animal. So come along with us and you'll see how everything is done today. Okay, so I'm going to try to explain what I'm seeing on radiograph here to make it easy to understand why we extracted the teeth that we did. I apologize if this doesn't film super great. I am filming on a computer screen right now. So right now, all of these images that I'm pointing at with my pen, those are all teeth. And then the rest of this white stuff up here is actually jawbone. So this is on the upper left side of the dog's mouth, and these are all molars over here. So what I noticed was on this molar, and this is that really big molar in the dog's mouth, the biggest one that you see. What I'm seeing here is this black hole here. In a healthy mouth, this would all be filled in with bone. So bacteria that get in here start to eat away at the bone, and there's no way for us to clean in this area. It's covered completely by the top of the tooth, so there's no way for us to get in here. So what we have to do is we have to just take this tooth out, and then we clean this area up and we sew the gum tissue over top of it. So this guy did lose that tooth. So on the other side of his mouth was kind of the exact same thing. So you can see again this big black area here. So it's just a pocket of infection. So he did lose that tooth as well. And then on this bottom tooth, this was a fairly interesting finding. So normally this right here, this is the line of the bone, and the bone should come completely right across that area. So all the way down here, we've lost a lot of bone here. And this guy even had this little S shape, is actually a draining tract. So an abscess draining tract. So this tooth absolutely had to go. So we could clean up this area and save this big molar. We want to save this guy because it's a big chewing tooth. So if we can take the tooth out beside it, we can hopefully save the ones, the other ones beside it and keep them healthy. All right, so you may notice that I look a little bit different, and that's because it's actually the next day. Our day ended up getting a little bit crazy yesterday, so I didn't have time to film a wrap up to the day. So I figured I would just do that now while I had some time. The dental yesterday went really well. We didn't have any concerns that we were too worried about. So in the end, we ended up removing 11 teeth from her mouth. That might sound like a lot of teeth, but dogs actually start with 42 teeth. So it's not that many overall. And those teeth were all infected and they don't feel very good to chew on. So they do much better with those teeth out than they do with them in anyways. She was actually a really good example as to why x-rays and an exam under sedation or an exam done under anesthesia is actually really beneficial. We could not tell the severity of her dental disease just by looking at her mouth. We had a good indication that we were going to remove the big molars in her mouth, but that's all that we could tell by looking at her mouth. And then when she was under and we were able to take those x-rays and we were able to probe around, we actually found several problems. So that's why we always recommend that we do x-rays, because we wouldn't find these things without the x-rays, and that's why we recommend these anesthetic procedures. So she did really well. She woke up well and she went home yesterday. We sent her home on antibiotics to clear up any remaining infection. And then she also went home with some anti-inflammatories for some pain. And then often people will say that they're better than they were before they went in and they act like a puppy. So if you have any questions based on what you saw today, or you are interested in having a procedure done on your animal, or to at least have a technician look and see what's going on in your dog's mouth, please don't hesitate to call us and we can book something in for you. So thank you so much for watching and have a great day.